Hello and welcome to Achieving Healthy Kids, What Works in School Environments. My name is Abby Becker and I'm a registered dietitian with the Central Indiana District Dietetic Association. We, along with the Marion County Public Health Department, the Indiana Healthy Weight Initiative, and the Indiana Public Health Training Center, are proud to welcome Dr. Margo Wootan to present for you guys today. Dr. Wootan is the Director of Nutrition Policy at the Center for Science and Public Interest, which is one of the country's leading health advocacy organizations that specialize in food, nutrition, and obesity prevention. She comes to us today with many years of experience in working to improve school health policies on many different levels. This month is perfect timing for Dr. Wootan to be here to present to us, as it is National Nutrition Month. National Nutrition Month is a nationwide campaign with hopes to encouraging people, health professionals, and lay to focus their nutrition and how it affects their health and well-being. This year's theme, Get Your Plate in Shape, embodies the basic principles of nutrition, which Dr. Wootan fights to incorporate into our youth school environment. As you know, here in the United States, there is an increasingly high rate of childhood obesity, and as a dietitian, this number still is very alarming to me, and I work each day to help prevent children from being included into the statistic. With programs like National Nutrition Month and people like Dr. Wootan and all of you, we can help to make the school environments of our children reflect their bright futures ahead. Included in your packet today is also a handout on National Nutrition Month and the theme, Get Your Plate in Shape. And I will now introduce to you Joan Trindale. Joan is a registered dietitian who held the position of Bureau Chief for the Population Health at the Marion County Public Health Department since 1999. Within this bureau, there are 13 different programs or departments that cross all client health services areas for the department, including nutrition and WIC services. She previously was the administrator of the nutrition and WIC services for Marion County and coordinator for the WIC program in Hamilton, Hancock, and Shelby counties. She completed her Bachelor of Nutrition from Cornell University and has a Master in Public Health Nutrition from Case Warren Reserve University. She is a past president of the Indiana District Dietetic Association and has been an active leader with the Food and Nutrition section of the American Public Health Association for the past 15 years and plus. Please welcome Joan.
Well, good afternoon. Thank you for being here, and thank you, Abby. I'm really grateful for the opportunity to be here today. It gives me a chance to put my RD hat on, which I don't get to do a lot of days, which I'm happy to do today, especially since we're recognizing National Nutrition Month this month, so I'm happy to be here. I'd like to welcome those who are from outside of Marion County. How many people came from outside Marion County today? Great, great, great. We welcome you to our county, and I bring greetings from our Public Health Director, Dr. Virginia Kane. I'd like to thank the Marion County Public Health Department staff that were instrumental in bringing this program to us today. Denise Ferguson, who is a public health nutritionist within our Nutrition Services Department. She's the brainchild for this activity today, and the support that she received from others in the health department, including Sandy Cummings, who is our coordinator for chronic diseases. And Sandy is a social worker by training, and it's also Social Work Month. So we share our Nutrition Month and Social Work Month, so kudos to social workers this month as well. Sandy was very creative in finding ways for us to fund this activity, along with Sean Wellman, who is our administrator for Nutrition Services at WIC, and Denise's boss. And Sean was able to find some money in her budget to help support this. And then Stephanie Thornberry has been doing a lot of the logistics today, and she's in a new position that we've created to focus more on schools, working with schools and prevention, as well as Michelle Shippey from Chronic Disease helping with some of the logistics too. So thanks to all the staff at the health department. I asked Sandy to find this slide because I just wanted to make sure that when we talk about the kind of things we're doing today, that we remember in the context of public health and what public health is broadly seen as. We certainly know that we have to impact at different levels to have impact on health of our community. Certainly individual factors that people have as genetics, their gender, their age, a lot of those things we can't modify a whole lot, but certainly when we get to individual behaviors, moving out to those institutions in the community that have impact on health, looking at the conditions, the environment in which we live in, and then just social, economic, and political issues that impact our ability to improve public health. So I think it's important that when we talk about impacting the school environment, which is our focus today, we know that we're looking at that public services and infrastructure kind of part of the rainbow there. And public health has a way of crossing all through the different areas of that graphic. So I just want to, in a context way, say we're focusing on an area that's very important, but there's lots more that we have to do in order to really impact the health of our community. At the Marion County Public Health Department, back in 2005, we undertook a massive screening of school-aged children. We went out and we weighed and measured children in schools. There are about 158,000 students in Marion County. Most of them eat something at school every day. When we did our measurements, we got 90,000 students measured. We learned that 40% of them were considered to be overweight, defined as greater than 85% percentile for their BMI. Well, we certainly, with 40%, would expect maybe 15% would be in that upper range, but there's another 25% there that indicate a possible issue there. I just want to remind us that that was a screening, that was not a diagnostic activity, that screenings are important. It gives us public health data, it gives us a benchmark to look at, but certainly those students that were identified would need more individual assessment to really make that diagnosis by looking at their growth patterns over time and seeing if there was any real divergence from their growth pattern. So, but needless to say, we screened a lot of kids and we found that piece of data. And we know that oftentimes children that are overweight become overweight adults, and that leads to a lot of the chronic disease problems that we have. Heart disease, diabetes, cancer. It's really incumbent on us to really work to provide for a better chance for long, healthy lives for our children. This is a commitment that we have at the Marion County Public Health Department. We acknowledge that there are no easy answers. There's no single answer, and probably no short-term answers to the question of how do we ensure all children to be healthy and fit children. Community health and elevating the level of wellness for all of us takes time, persistence, and a very large collection of very small steps. Those of us that work in public health have to be patient people because nothing will happen and change overnight. But look at the changes that we've been able to accomplish through public health efforts. The changes in smoking in public places, the increases in child care seat use and seatbelt use, the massive decrease in infant mortality over the past century, huge declines in air pollution, the vast improvement in cancer screenings, and so many other successes that we see that none of which happened overnight, but rather a persistent movement involving many sectors and ultimately the public demand to lead to changes that made for healthier environments for everyone. I think all in this room would agree that the food environment in our society today provides for far more unhealthy choices than healthy choices. This is what we need to change to assure a healthier next generation. Schools are but one sector, again looking back at our rainbow graphic there, but it is one that almost all children in society pass through. So it's a logical place for us to put some of our efforts. I've had the opportunity to work with Margo Wootan in the past through the American Public Health Association Food and Nutrition section, so I've known her for some time, and I'm very happy that we finally got you to Indiana, so thanks for coming to be with us today. Margo is the Director of Nutrition Policy for the Center for Science in the Public Interest, and it is one of the country's leading health advocacy organizations that specializes in food, nutrition, and obesity prevention. She also received her bachelor's from Cornell, just recently realized that. And she has her doctorate from Harvard. She has been very active in coordinating activities of NANA, stands for National Alliance for Nutrition and Activity, and she's a member of the steering committee for the National Fruit and Vegetable Alliance. She has coordinated and led efforts to require trans fat labeling, improve school foods, reduce junk food marketing aimed at children, require calorie labeling at fast food and other chain restaurants, and to expand the nutrition and physical activity program at CDC. She's worked hard as an advocate to get more funding streams for these activities down to the state and local level. Margo has received lots of awards, and she's regularly quoted in the national media. I recently saw you quoted in Newsweek, so you've made the big time, Margo. We're very happy to have her here. Let's give her a Hoosier welcome to Margo Wootan.
Well, it is great to be here this afternoon. And it really is a very exciting time to be working on nutrition, physical activity, and obesity. We know we have a huge problem, and I'm not going to show you lots of stats about, the rising obesity rates and the problems that it causes. I figure most of you all already know that, and that's why you're here. But I think to start, it's just good to think about that we're getting there. And I like how Joan talked about it. You have to be patient in public health. You have to also be impatient and keep pushing for change and pushing things forward. But I feel like in the last couple of years, there really have been some important changes. Over the last decade or so, folks have been working on improving school foods, and many school districts and a dozen states have passed laws to get junk food out of schools. And I'll talk about today, we finally have passed a national law that's going to get soda and candy bars and other unhealthy foods out of schools. We've worked on menu labeling to try to help people make healthier decisions when they're eating out, which is a growing part of people's diets. And over the last 10 years, almost 20 states and localities have passed policies to require calorie labeling at chain restaurants. And just in 2010, we were able to pass a national law. And so in the next couple of years, we'll be seeing calorie information at chain restaurants across the country. Companies have become more responsive to parents' concerns about food marketing to kids, and a number of the biggest food manufacturers have agreed to change the way they market to kids. Still not where we want it to be, but some progress. So I think we're starting to see some very important changes, these just being a few of them. But overall, we still have a long way to go. Americans live in a food environment that makes it very hard to eat well. And I think one of the things that has also changed, in the past in nutrition, people almost exclusively relied on education to try to change people's eating habits. And education is, of course, very important and a key part of what needs to be done. But people don't eat just based on what they know is right or wrong, or, good or bad, healthy or unhealthy. People eat for lots of different reasons. Our eating habits are influenced by food policies, by agriculture and what the farmers decide to grow, by food manufacturers, what they decide to make, how they process the food, how they price it, how they market it. We're influenced by food availability, what's available in our neighborhood, what's available on the menu at a specific restaurant, what's available in our workplace, that our eating habits are shaped by so many outside influences that it's not enough to just educate people. Though education is important, we also have to think about the environment in which people live and make it possible for them to eat well if they want to. So some of the things, I'm not going to talk comprehensively about the environment, but some of the things that influence our environment, one is that food is everywhere. Everywhere we go, they have food. At gas stations, at the Best Buy. I can't buy a set of printer cartridges and walk out without passing through this big aisle of candy. I noticed one day I was running errands, and every place I went there was candy and chips and other unhealthy foods at the checkout, not just in the grocery store, but at the gas station, at the Best Buy, at the toy store, even at the clothing store where I was picking up something for my daughter. That the ubiquity of food means that if you have the slightest twinge of hunger, if you have the slightest inkling that you might want to eat, there's all this food right there. And then even if you're not hungry, the food stimulates your desire to eat. I know by the end of that day running errands, I was dying for a Snickers candy bar. That morning I did not wake up thinking about candy at all, but I just kept seeing it again and again and again, like it's taunting you, like it's, enticing you. And that ubiquity of food makes it harder for people to eat reasonably. We're eating out a lot, about a third of our calories. The portion sizes are gigantic, and those big portion sizes influence not only what we eat when we're in restaurants, but it also influences the whole way we think about food. And so that normal size portions look tiny to us. I was talking this morning about, I think of those 8-ounce Cokes as being so cute, like, oh, those little tiny cans of Coke, aren't they cute? But when Coke first came out with its soda decades ago, a 6.5-ounce Coke was considered a normal size Coke. At McDonald's, when they first opened, they offered a hamburger, French fries, and a soft drink. That meal today is considered a child's meal. And now, an adult meal, a real meal, is, more like a quarter pounder with cheese, a big order of fries, and a big soft drink with, over twice as many, I think about 3 times as many calories. So these big portions affect us. And studies show that they affect us in ways that are subconscious, that when somebody sets a plate of food in front of us or a portion in front of us, we think that that's an amount to eat. And then even if we don't eat the whole thing, that helps to decide how much we're going to eat. People tend to eat what's put in front of them. And if you give them a big bucket of popcorn at the movies, they're going to eat a lot more than if you give them a small serving of popcorn. The other thing is sugary drinks. That sugary drinks have become a part of our daily lifestyle. They're not the treat that they once were. And sugary drinks are now the #1 source of calories in our diets. We actually get more calories from soft drinks than we get from bread, from hamburgers, from French fries, from any other individual food. And people don't even think of it as food. And they end up, maybe eating the same size meal as they otherwise would, but adding a soft drink onto it. So, if you went to a restaurant and you got a 1,000-calorie meal, as they tend to go these days, you probably eat the same amount whether you drink water with no calories or you drink a 400-calorie soft drink with free refills, just in case 400 calories worth of soda is not enough for you. So we're getting a lot of calories from soft drinks, and soft drinks are the only food so far that have been directly linked to obesity. And we know that this one particular food is quite problematic in our diets. So in addition to being bombarded with food itself and the presence of food, we're also bombarded with lots of messages to eat. How many times are you sitting watching television? You've just had dinner, you're not hungry at all, but commercial after commercial, and before you know it, you're getting up without even thinking and going to the refrigerator to grab a little snack. That marketing works. Companies know it works, or they wouldn't do it. And people are exposed to so much marketing. I'm especially concerned about the marketing aimed at our kids. Kids are exposed to about $2 billion worth of food marketing each year. And the marketing in and of itself isn't the problem. The problem is the kinds of foods that are marketed to kids are mostly unhealthy food, which shapes their diet and their expectations of what to eat. It's not a matter of parents not being able to say no. And, you know, anyone who's a parent knows they say no, no, no over and over again. What companies know is that parents say no about 9 times for every time they say yes, and that they just have to get your kid to bug you enough to get to yes. They also are influencing kids' diets in a way that's much more subtle than that. They help to shape what kids expect to be fed, what they're willing to eat. So there's a reason why in schools they're serving a lot of chicken nuggets, French fries, and hamburgers, because those are the kinds of foods that are in children's meals at restaurants that restaurants are spending billions and billions of dollars marketing to kids. So all these influences on our eating habits is not to say that people are not ultimately responsible for what they put in their mouths, that, you know, ultimately we each decide what we're going to eat, and as much as we can, when our kids are home, we decide what we're going to feed them. But it's to say that it's very important that when you're working in nutrition, whether you're counseling an individual patient, whether you're doing a program in a school or childcare, aftercare, you have to recognize that there are all these influences on people's diets. And if we don't address them, it's very hard to get people to change and to sustain that change. You know, there's a reason why diets don't work so well. You know, even when people are really motivated, they lose 30 pounds, and then it gradually comes back because we, you know, are still in this environment where it's so easy to eat, to overeat, and to eat the wrong kinds of foods. So in addition to education, we need to address ways to make healthy eating easier so that it's more possible for people who want to eat well to be able to do it, so that it's more possible for parents to feed their children well. There's no evidence to show that over the last 30 years, as obesity rates have climbed, that willpower has declined. You know, we're not weaker, we're not lazier. We don't love our kids any less than people did 30 years ago. It's just that there's so much food everywhere we go. It's more and more unhealthy, it's more calorically dense, and it's just harder as a society to eat well, to be active, and to maintain a healthy weight. This is a societal problem. You know, any problem, any health problem that affects 2/3 of the population certainly isn't caused by individual failings or, you know, solely by individual responsibility. So this is something we need to work on together to try to change the food environments to make healthy eating easier. Now, the environment that most people have started with, when states and communities, when folks come together and think about how to address obesity, most often where they come together to work is in schools. You know, it's good to start with kids while they're young, before their habits are too ingrained. And kids do a lot of their eating at school. Kids eat about 1/3 to 1/2 of their calories during the school day. And so, I mean, they're spending a lot of time at school, but many kids eat breakfast at school. In elementary school, they eat a snack. Almost all kids eat lunch. Many kids go to aftercare and they eat another snack or an after-school meal. That kids are eating a lot of calories. So with schools, we're not asking schools to take on the responsibility of feeding kids. Actually, Harry Truman did that back in 1940, and that's been the way it's been for a long time. And somebody wants to argue with what Harry Truman did, let them. You know, that's not someplace I'm going to go. But now that schools are feeding kids, you know, the question is how they should do that and how they can make it better and how we can take the national investment in school meals, which is quite significant, and make it more effective. So to try to help, we worked with Congress to pass the Healthy Hunger-Free Kids Act in December of 2010. And that was just the usual, every 5 years, Congress has to reauthorize the child nutrition programs. And this time around, there's a very thoughtful assessment of how are things going. I think given the high concerns about obesity and children's diets, advocates the Obama administration, members of Congress on both sides of the aisle really looked at these programs to see how they're working, what's not, how they can work better. And together we passed one of the strongest child nutrition reauthorizations in decades. As a result of that law, Congress required USDA to update the standards for the school lunch and breakfast program. USDA proposed standards in January of 2011, and then they came out with the final standards, which you probably just heard about in January. So those new standards really will set the benchmark for school lunches, I think, in a place that will do a lot to help the health of our kids. Now, many schools are already there, but this will help, help us work with all the rest of the schools across the country to serve healthy meals. So the new standards set maximum calorie limits for the first time. They also reduce the calorie minimums. So the amount of food that will be served in the school lunch program will better reflect concerns about obesity. It'll still be plenty of calories to ensure that low-income kids get the good nutrition that they need, but it will also address concerns about obesity for the first time. There used to only be calorie minimums, and schools could then serve as much extra food as they wanted. Now schools are going to be working more to provide reasonable amount of calories in the meals. Kids also aren't eating enough fruits and vegetables, and the new meal patterns will double the amount of fruits and vegetables that'll be served. All the grains over time will need to be transitioned to be whole grain rich. They won't have to be 100% whole grain, though they could be, and some schools are doing that, but they'll need to be at least 50% of the grain in each grain product will have to be whole grain. So if there are cookies served, if there are pizza, rolls, hamburger buns, all the grains will need to have a decent amount of whole grain. The milk will need to be low fat or fat free. All the products that are served in the school meal program will need to be free of trans fat. And gradually over time, schools will need to reduce the amount of sodium in the meal programs. Now, you may have heard back before the holidays that Congress interfered in a number of ways with these new meal standards. Congress attached a rider to the spending bill for the U.S. Department of Agriculture, and much to nutritionists' chagrin, they declared that pizza must, by law, continue to be considered a vegetable. So USDA had proposed no longer giving concentrated tomato sauce kind of an extra credit toward counting as a vegetable. And Congress, at the behest of pizza manufacturers, ended up interfering and telling USDA that they couldn't do that. They also didn't allow USDA to limit the number of servings of French fries in the school meal program. Congress decided that 2 servings of French fries a week was nearly not enough, and that French fries should be available every day. I don't think they were thinking about what kids need so much as what the potato growers and the French fry manufacturers were lobbying them to do. So those 2 things USDA wasn't able to change, but otherwise the standards that USDA has proposed are quite strong, very much based in good, sound science, and I think will help to really change the school lunch program nationwide in a way that will help kids to form better eating habits. Now, some school administrators and school food service directors and others have expressed concerns that these meal changes are too expensive, that they can't afford them. And USDA heard those concerns, and it did lower the costs by changing what will be required, especially of the breakfast program. They, for example, eliminated the requirement to serve meat at breakfast, and they changed a few other of the standards to bring the cost down. So the cost is not as much as initially proposed. Also, in the Healthy Hunger-Free Kids Act, we were able to include a number of provisions that'll bring more resources into schools to help pay for these healthier school meals. One is that schools can apply to have get an additional 6 cents per lunch in increased reimbursement if they meet the new meal standards. The guidelines for how schools can apply and qualify for that money will be coming out very soon. There's an interim final rule with all the details of how schools can get that additional 6 cents in reimbursement coming out very soon. It should be out, within the next couple of weeks. Also, schools need to gradually over time increase the prices for paid school lunches so that they cover their own costs. Right now, oftentimes school districts are setting the price for school lunches at a price that's lower than what it actually costs them to produce that lunch. They think that if they keep it low, that's necessary in order to keep the kids participating. But USDA has found that around the country, when they set reasonable prices for paid lunches that actually cover their costs, that kids continue to participate, and then money isn't taken away, shifted from providing healthy food for low-income kids. That more money will be there to provide healthy foods for the school lunches. And then also many school districts are not pricing their a la carte foods in a way that covers all their costs. A lot of us think that, or have been led to think that a la carte foods subsidize the school lunch program, but actually it's the other way around. Usually the prices paid for, pizza or chips or Little Debbie snack cakes or other foods in the a la carte line are priced lower than it actually costs the school to sell and serve those. And so money is diverted from the lunch program into subsidizing the a la carte foods, and that won't be allowed either. And then USDA is also looking at the overhead charges that schools are charging. Some school districts are charging their food service for janitorial services, for health care, for their food service workers, for the lights, and for other charges that they don't charge the math, the science, or other departments in the schools. And that takes away money from being able to provide more fruits, vegetables, whole grains, and other healthy foods. And it's interesting, some school districts charge the food service program a lot. Some school districts don't charge the program at all. And so the amount of money that school districts have to provide healthy lunches really varies. And so USDA will be looking at what's going on in this nationally. It might also be a good thing to look at within your own school district or across the state to see what those indirect charges are, because changing the indirect charges could really free up a lot of resources that could help provide more money to schools for serving healthy school meals. One of the other provisions we were able to include in the child nutrition reauthorization is for helping to increase accountability and compliance with the new school meal standards. That it's not enough to just have standards. We need to help schools to meet those standards. So USDA is revising the accountability system so that schools will be assessed for compliance with the school meal standards more often, every 3 years instead of every 5 years. There's also a transparency requirement so that schools are going to be reporting on their wellness policies and the nutritional quality of their meals. There also is going to be more technical assistance and training. USDA is going to be establishing a database with model product specifications for how schools can better use their commodities. USDA has done a very good job over the years in improving the nutritional quality of the commodities that are provided to schools. A lot of people think that school commodities are butter and extra pork that the farmers need bought up for price stabilization, but really the overwhelming majority of commodities that are provided to schools are foods that the school districts themselves choose from a very long list of products. And those extra bonus commodities, when there's a glut of pork that, is made available to schools, that's really a tiny fraction of the commodities. That's not the regular commodity subsidies that schools are relying on. The school commodities are very important. They provide a lot of resources, almost 20 cents per lunch. And schools really rely on those. But it's important that we help schools provide them with some product specifications and ideas for ways that they can use those commodities in healthier ways. So rather than processing the frozen chicken breast into a deep fried chicken nugget, processing it into something else. There's now like chicken fajita meat that schools use, or some schools have found different formulations for chicken nuggets that are whole grain, that are not deep fat fried, that the kids really like. And so sharing recipes basically around the country between school districts for how to better use those important commodities. Schools are really going to need your help, your support, to meet these new meal standards. It's not easy to feed thousands of kids on the budget they have, in a very short time period. It's a very difficult job. And so as much as we can work cooperatively with school food service and provide them with the support they need at the state and the local level, I think the better. I think also to help identify those schools that are especially struggling and connect them with schools that are doing a good job so that they can mentor and help each other. The school pricing provisions, which I mentioned, I think a lot of schools will need help to better understand that and why it's important, and to help explain it to parents. USDA is only requiring a very gradual increase in the pricing of school meals, no more than a nickel a year, which amounts to less than $9 per student per year. And so those changes can happen very gradually if that's important in a school district. But it's important that those additional resources be brought in. The other thing that schools need help with is just identifying healthier foods and recipes and menus that kids will like. And so USDA provides recipes and model menus, but I think engaging kids in your own school district is really important. Schools have had good luck with taste testing, where they've had the kids taste new recipes, new products that they're trying, a new brand of pizza, a new brand of chicken nugget, a new chicken taco, new items also for the vending machine for fruits and vegetables. Schools have had contests and had voting around it. They've had different nutrition education activities that go around with the new menu item to help explain, something of the heritage or history or fun facts related to the food. So it's important that we engage the kids in this transition as we move toward healthier foods. I think also schools have had good luck engaging the kids in marketing the programs to each other. I feel like school lunch really has a bad rap. You often hear about, this slop that schools are serving and nobody likes it and won't eat it. And then, I go eat at the school and the food is fine. It looks great. It's just that kids have been talking and, parents have been disparaging school lunch for so long. They don't even know what changes have been made. The school lunch they're talking about is, what was served decades ago, or was, served one place where they saw a news story, had nothing to do with what their own district is doing. So sharing information with the kids, getting the kids engaged in understanding what's being served and getting them to market it to their friends. I think sending information home to parents. I know in DC public schools, where my daughter goes, they made a lot of changes to the school meal program, but none of the parents know about it. They don't realize that the vendor's been changed, that all the recipes have been changed. They moved to a central kitchen where there's a lot more scratch cooking. There's 30% of the food items are locally grown. They've done so much to make changes, reducing the sodium, removing all the trans fat, going to low-fat milk, and parents just have no idea. So they picture the school lunch however they last saw it, which may be when they were in high school, or maybe one time when they visited school. So it's important that we share more information about what's really going on. So the child nutrition reauthorization also included a really important provision related to the foods that are sold outside the meal programs through vending, school stores, a la carte, and fundraisers. I have to say it's a little hard for me to believe, but it took about 10 years to pass this part of the law, to simply get soda and candy bars out of schools. It seems now like such a no-brainer, but 10 years ago, this was so incredibly controversial. I remember even some of our partners in public health, were resistant, and we used to hear, kids need choice, schools can't afford to do this, all these excuses which turned out not to be true. One concern that schools do raise is that when they get rid of the unhealthy foods, that they won't be able to make money. And that's turned out not to be true, as schools have switched to healthier options, as they've gotten the junk out of the vending machine, the a la carte line. Kids are still hungry and thirsty, and they still buy what's there. Oftentimes what happens too is the kids stop buying a la carte and instead get the reimbursable school meal. And so participation increases in the school meal program, and the kids not only get a better balanced meal nutritionally, but then the school also gets the reimbursement from USDA, because even if an upper income child is paying for their lunch, USDA still provides 27 cents in reimbursement plus about 20 cents in commodities. So the school gets more money in addition to the child's lunch money. So it turns out to be more profitable, more financially beneficial for schools if a child buys a balanced meal as opposed to if the child buys something in the a la carte line. So funding most schools seem to raise as much, and some even raise more money when they switch to healthier options. Now, one issue that's bound to cause some controversy when the USDA proposes its competitive food standards are related to fundraisers. So in the law, USDA has full authority to set nutrition standards for fundraisers, but they can provide limited exemptions for fundraisers if they want to. They don't have to, but they, politically, they probably will. Those exemptions can only be set for fundraisers that are infrequent and that are approved by the school. Fundraisers are important to lots of people. They're important to the PTA, to the school clubs that want to raise money. They're important to food companies that use these branded fundraisers to market their products to schools. A lot of the companies that offer fundraising opportunities in schools really are in it not just for the money that they can make now selling their products, but also as a marketing approach. And these programs are often run out of the marketing department of companies. So Hershey Candies, Krispy Kreme, Little Caesars, they want to cultivate brand loyalty. They want to market their product in schools because that's where the kids are, and it's a relatively uncluttered media market, and they can get their message across in a unique way. But having kids sell unhealthy foods to their peers, and the sale of any, very unhealthy foods to kids in schools really sends the wrong message to kids. It sends the message that nutrition isn't important, or that money is more important than nutrition, or that we're not taking nutrition seriously. And so it's important that kids get a consistent message about nutrition in the classroom, in the cafeteria, in the hallway, throughout the school day. Also, we just don't need to sell all this junk in schools. There are many other healthy fundraisers that are profitable, that are practical, easy to implement. Schools can make just as much or more money on bowl-a-thons, fun runs, selling bottles of water, selling wrapping paper, candles, Christmas trees, plants, fruit baskets. Schools have done well with a wide range of fundraisers. This report, Sweet Deals, talks about the pros and cons of a number of different fundraising options, and in the back has a list of over 60 fundraising companies that have, pre-made fundraising programs that schools can use. I think it's very important to help schools realize that switching to healthier fundraiser doesn't have to mean less money, and to give them ideas about the kinds of fundraisers that are available. So on school, the national nutrition standards for the foods that are sold outside the meals, USDA is largely done writing those new standards. Those will go to the White House for final approval, and then they'll come out for comment. So there'll be about 90 days where the public will have the opportunity to comment on them. So one of the things, I passed around a couple of clipboards, and I don't know if they've made it up and back in all three sections, but there's an opportunity to sign a petition to Secretary Vilsack, who is the Secretary of Agriculture, which is writing these standards, just urging them to develop strong national standards. That's one way that you can help to support these standards. But what we'll do is we work in a coalition, which Joe mentioned, called the National Alliance for Nutrition and Activity, which includes the American Heart Association, American Cancer Society, American Public Health Association, National PTA, American Medical Association, a wide range, about 300 groups. And we have a committee that's coming together that will analyze these proposed nutrition standards for vending and a la carte, that will write up a model comment, kind of outlining which provisions seem to make sense in terms of children's health, which ones don't, and make suggestions for change. So if your organization is interested in commenting on the proposed regulations, that would be very helpful. We'll also make an action alert available, which you could send out to your members, or just you as an individual could sign a letter and send it to USDA in support of strong nutrition standards. We're going to need that help because we are expecting some opposition to this. We know the pizza manufacturers will be out in full force again. Who knew that, frozen pizza was so powerful in Washington, but actually the biggest manufacturers of frozen pizza happen to be in a few influential members of Congress district, and so they had quite an influence. They are trying to get an exemption from these nutrition standards. We know that the soft drink companies want to have sports drinks in schools. Each industry has their own part of the rule, their own particular aspect of the nutrition standard that they want tweaked so that they can get their product into schools. So, as many people who are willing to send letters, make phone calls, that would be very helpful. We also think that the industry will go to Congress again if there are parts of these standards they don't like, and ask Congress to legislatively interfere and block USDA from taking action, just like they did with pizza and French fries. And so it would be helpful if some of you would be willing to contact your members of Congress as this moves through the process. After the comment period, there'll be a final regulation, and then there'll still be a phase-in period, probably another year or so, until these go in full effect. So it's going to be a couple more years before these national standards are fully implemented in schools. So in the meantime, there's still a lot of work to do with school districts around the state to try to help them improve their nutritional quality of their offerings. And then there'll be even more work to do with them to help them switch over and find healthy options that the kids like once the regulations go into full effect. The Child Nutrition Reauthorization also included a section on school wellness policies. The school wellness policies were a compromise policy that was implemented as a result of the Child Nutrition Reauthorization in 2004. And actually, we were trying to get national standards to get junk food out of vending and a la carte back then, and we were unsuccessful. And I have to confess that wellness policies were the compromise, the political compromise, the consolation prize that came out of it. But I think it was a very sensible approach. Wellness policies are important for engaging each school district in nutrition and physical activity, to implement national and state standards. So to use the wellness policy to help get better school lunches, to get junk food out of the vending machines, to maybe implement statewide PE standards or policies around recess. They're also important for setting policy around issues that would be unlikely to be addressed through national policy. You know, we're not going to pass a national law that says how many parties schools can have in, you know, during the school year. That's something that's better determined at the local level. And so things like school parties and food rewards are probably more likely to be addressed locally in a wellness policy. What we found since the wellness policy law was passed is that schools are doing a pretty good job in developing a wellness policy. Most school districts have a wellness policy, but schools are struggling more in implementing those policies. And so the reauthorization focuses a lot on how to help schools to better implement the nutrition and physical activity wellness policies. And here, you know, this is mostly going to be a matter of you all and other folks working with school districts and individual schools to implement policies. We can set some national standards which can provide a framework to work on these issues, but there's no way that USDA is ever going to be able to enforce schools implementing their wellness policy in every single school across the country. That's just not, you know, it's not the way the wellness policy was designed. It really requires community engagement, you know, that there has to be local support for implementing the wellness policies. USDA will be providing more technical assistance and training and materials around wellness policies, but hopefully you all can work with schools too and provide some assistance as well to help schools update their wellness policy, to develop implementation plans and then carry them out. The national law encourages schools to have a wellness policy committee or to work through an existing school health committee, but that's not a requirement. I think that is a way that schools have found is fairly effective for figuring out what the best policy is and how to implement the policy. I think school districts also have had more luck in implementing policies if they have someone in each school that's also willing to work on the wellness policy, that it's not enough to just have a wellness policy district-wide, but you need to make sure that each individual school is aware of the policy, is motivated to implement it in their own school. And so having someone within the school, a PE teacher, a school nurse, the school food service worker or other, you know, a health teacher, someone in the school who's interested who can help bring the policy to life at the local level. Now, wellness policies can also be a way to address other parts of the school environment. That one of the things I think is really important to address is food rewards. It's not a big part of kids' diets, although a lot of times schools get, you know, a teacher will give a pizza party or a donut party, or they regularly give candy if the kids do well or are good or are quiet. You know, too often food is used as a reward for rewarding academic achievement or for rewarding good behavior. And, you know, a lot of people say, well, what's wrong with, you know, one little piece of candy? You know, one Starburst isn't going to hurt anybody. But the problem is the message that it sends to kids and the connection between food and mood that's created that can have a lasting influence on kids' eating habits. And so it's important to reward children and encourage good behavior, but it's not a good idea to use food to do it. There are lots of other ways we can show children that we care, that we can treat children, that we can help move them in the right direction. We have a resource on our website that lists lots of other ways to reward children, whether it's through social rewards or recognition or other small trinkets. There are endless other ways to encourage good behavior or to reward children without using food in a way and without harming children's long-term diets and health. Another issue I think is important are school parties. Again, it's not going to be something we're going to ever have national law on, but school parties have just become so commonplace, especially in elementary school. I know when my daughter was in elementary school, there would be, 22 kids in the class. There was VIP day. There was 100th day of school, like any excuse to have cupcakes. And then there was more than just cupcakes. Oftentimes there was pizza and cupcakes and chips and a candy goodie bag to bring home. And then the child ends up having, several different parties. On Halloween, I think at one year we were up to 6 or 7 celebrations. We had trick-or-treating at the zoo, trick-or-treating, party in class, a party in aftercare, a party with a friend, a party in our neighborhood park. That each holiday just ends up being so out of control. It gets to be so frequent that these treats aren't really treats anymore. You notice how at restaurants, desserts have gotten to be so outrageously huge and extravagant. It's because a little cupcake isn't a big deal. Kids have a little cupcake all the time. They need like a giant, massive, brownie sundae covered with whipped cream and hot fudge for it to seem special, because just a regular treat, is not enough. So we have a tip sheet on how to celebrate in healthier ways, which is in your folder, and gives a few ideas. Oftentimes kids just want to be recognized. They just want to feel special on their birthday. And I think culturally, we need to learn how to treat kids in ways other than just using food. Food has become kind of a lazy way to interact with other people and to interact with children. And there's so many other things that you can do that children will enjoy just as much or more. Another part of the school food environment which influences children's eating habits is food marketing. There is so much marketing, as I mentioned before, about $2 billion worth of it a year. Now, some people just say parents should turn off the TV. If you did that, with a small child in America today, it would help. It would reduce the marketing that a child saw, maybe by about 30–40%. But that child would still be bombarded with tons of other marketing. Foods are marketed to kids through the internet and the games on the internet, through packaging, through toy giveaways at fast food restaurants, through mascots and spokes-tunes, and lots of very innovative ways almost everywhere the kids go, including in school. The school marketing is particularly concerning to me because I think most parents don't know that it's there. Because when your child gets to middle and high school, you're not allowed to go to school anymore. As a mom in elementary school, I would drop my daughter off at her classroom every day. And, you were regularly in the classroom reading or helping with a project or, chaperoning a field trip. In middle school, I have to drop my daughter off at the corner so no one sees, that, and she's a good kid, it's not that she doesn't love her mother, but, God forbid I should kiss her in front of her friends, you have to say goodbye from a distance. So you just don't get to go into the school. You don't know what's there. You don't see the posters on the wall or the kinds of marketing that the kids are exposed to. The marketing is almost all for unhealthy foods. In schools, by far the biggest product marketed in schools is soft drinks. It's not only the direct sales of the branded soft drinks through vending machines, but the front of the vending machine is an unhealthy beverage. I don't have one there. But even the products that the companies themselves consider healthy to market to kids is pretty pathetically weak. The food industry has a self-regulatory program called the Children's Food and Beverage Advertising Initiative, and they just updated their nutrition standards for food marketing to kids this past summer. And this is what they consider as okay to market to kids. Sugary cereals, SpaghettiOs, popsicles, Kool-Aid. I think it's reduced sugar Kool-Aid, so that makes it okay, I guess. But, the companies themselves they're saying that they're willing to reduce marketing to kids, but their policies on food marketing to kids are quite weak, especially in schools. And so we need to address that more. Marketing in schools happens through a lot of different ways. In addition to the food sales, the fundraisers, there's also educational materials and curricula. Companies are very smart in providing free materials to schools. Sometimes they're nutrition related, like the dairy industry has nutrition curricula. Other times it's, McDonald's Black History Month or safety awareness kits. They have posters and signs which they give to schools, the fronts of the vending machines, scholarships. There are lots of label redemption programs, proof of purchase like box tops for education or Campbell's labels for education. There are educational incentive programs like the Pizza Hut Book It program. So these are oftentimes programs that are marketed, that are provided to schools, that are positioned to seem like they are altruistic, like they're donations. Like, the school is, Campbell's or General Mills is donating money to the school. But it's not. These are programs that are marketing their products, that are run through the marketing department, that are meant to cultivate children's preferences, brand loyalty, and their diets for the rest of their life. Some things like box tops for education or Campbell's labels for education, the schools actually raise very little money from those programs, and they're a lot of work. And the overwhelming majority of products that are eligible through those programs are unhealthy. They've brought more non-food products in, but the food products that are available under the General Mills and the Campbell's program, over 80% of the food products are unhealthy. They're too high in fat or salt or devoid of fruit or vegetable or whole grain. And you've got to collect a lot of box tops to make it worthwhile. It's really a lot more work than it is worth the money that schools are getting. One of the other things that we've been doing on food marketing, so we have had some states introduce laws to address food marketing statewide, or the state can do this through statewide Board of Education policies. A number of states like Arkansas, New Jersey, and others, that's how they did their competitive food standards. They set standards for vending machines by addressing it through their state Board of Education. Local wellness policies, school boards, or district policies can also be used to address this. Another thing that a few school districts and states are looking at is just initially getting a sense of how extensive school marketing is in their school or in their state. You could pass a statewide law to require a statewide assessment of food marketing in schools, or you could undertake an assessment in your own school district or a school that you're working with, just to see how much marketing there is and which kinds of marketing are most problematic. So I know I'm supposed to talk mostly about schools today, but I wanted to mention one other policy that is important, kind of a parallel to schools. Oh, and here's our model wellness policy, schoolwellnesspolicies.org, which was developed by the National Alliance for Nutrition and Activity. So work sites, are the parallel of where adults are spending their time, like kids are spending their time at school. They're doing a lot of eating there. You can position this as important to workplaces themselves because they're paying for the health care costs of their employees and disability and absenteeism. But I'm particularly interested in having state and local health agencies or organizations like your own organization adopting nutrition policies. That if we are going to, ask schools to change what they're serving, we should be doing a good job ourselves and setting the right example. I think it doesn't make any sense for a state to have a statewide obesity plan and program and to be working on nutrition, physical activity, and obesity and asking others, you know, senior centers, schools, child care facilities, to change the way they eat if we're not addressing the way we eat ourselves. I think it makes us better advocates. I think it makes us more credible. It doesn't make sense also for states and localities to spend taxpayer funds on junk food, to have soda at conferences and meetings, to be serving unhealthy foods in correctional facilities or in state-run child care facilities, to have publicly funded hospitals that have lousy cafeterias so that when people come to visit, they see that the hospital, that the state doesn't care about health. You know, hospitals, we were talking about at lunch, not to pick on the hospital, but, you know, hospitals are supposed to be places where people go to get well, to get fixed. And then people go to the cafeteria, and there are all these sodas and sugary drinks and food that, you know, is mostly white flour, where there's not enough fruit and vegetable choices, where the salad costs a fortune and the hamburger is really cheap, that I think it's really important that we look at our own dollars, you know, what we're spending on food, what we're providing to people in the state or our county or our city, what we're serving to our, you know, ourselves and our colleagues, to provide a positive role model, just good government, to use those funds well. And it's an inexpensive way to address nutrition and obesity in these times of tight budgets. So the other thing it does is it influences the food industry, because if the whole state of Indiana switches to, you know, foods that are lower in salt or that don't have any trans fat or that are mostly whole grain, that's going to spur the manufacturers in the area to make those products available because you're a big buyer. So this is not just for work sites, but also, you know, works the same for government property. So there's a number of things that you can do. You can set nutrition standards for the foods that are sold and served. The standards might be different in different places. Certainly you're going to have different nutrition standards for a child care facility than in a senior center, than in a hospital. It's going to be different for the patients than for the workers. In a correctional facility, you know, for adults, it's going to be different than for kids. Provide healthy options. Make sure that there are, you know, a lot of healthy choices available. Price them in a way that the healthy choices are very competitive, have an advantage compared to the unhealthy choices. So the hamburger should cost more than the turkey burger. The French fries should cost twice as much as the sides of baby carrots. The water should cost less than the soda. Now, some of these changes might take time because you might have a long-term contract. Oftentimes you can renegotiate what's available within that contract, or you may have to rebid the contract, you know, after a certain amount of time, the next time that's available. Changing what's in the vending machines is important, again, for the message it sends and for the health of the workers and the people who are visiting. State programs, and then education, motivation, social support to go along with the changes. Now, there are different ways to do this. Let's see. So some places like New York City and Mayor Bloomberg, they just do it. You know, they've gone all out. They've set citywide standards for pretty much everything. All city property, the cafeterias. They started with the beverage machines and then went to the snack machines in correctional facilities, child care, homeless shelters. They've devoted a lot of resources to this. Other places with fewer resources or where politically that might not be as easy, they've done this more in a phased-in way. So in Rhode Island, in Delaware, they started with parks and recreational facilities, changing the vending machines, and then next they're going to go to the cafeterias. Lots of other places have started with the Department of Health and like kind of use the Department of Health as a guinea pig, try out different policies, and then move on. So through the National Alliance for Nutrition and Activity, we are just starting to develop a model vending policy for government property. Next, we are going to be working on a meeting policy, and then working to adopt these policies ourselves so that when we have meetings and conferences among our coalition partners and each of our individual organizations, that we're only serving healthy options, that we're making the healthy choice, the obvious choice, the easy choice. So we're making some progress overall, I think, in addressing healthy eating, but I think particularly in schools. There's really been a lot of focus on healthy school foods over the last 10 years. And I think one of the things about nutrition policy is that, so many people who work in nutrition have a day job. They have a set of responsibilities that they need to do. They see patients all day. They plan meals for their school, their school food service director, that they have a lot of other things to do, and that sometimes the policy gets left behind. It's some action alert you got from the State Heart Association and from the Diabetes Association that you keep thinking, I'll get to tomorrow. But we really all need to pull together as much as possible to support these changes that organizations are making, that that the state is making, that the USDA is making, that, coming together, we really could have a big influence. I think that there's a budding nutrition movement, but it's not. And there are parts of it which are very strong, and there are some coalitions which are very strong and working together. But I think that we could work together much more effectively. And when we put all of our small voices together, it gets to be so loud that I think they'll have to stop ignoring public health nutrition, that they'll have to give the state more reasonable resources for addressing nutrition and physical activity. Obesity is one of the biggest health problems that this country has ever faced. I can't think of anything else that affects so many Americans. 2/3 of us are either overweight or obese. Enough so that it puts our lives at risk. We're at risk of heart disease and diabetes. That we're making some progress, but we really need to step it up and demand these changes for our kids especially. And I think when it comes to schools, that we've laid a lot of the groundwork. I think a lot of schools are ready for these changes, but we need to help them to get there so that in the next couple of years, the majority of schools have healthy foods, throughout the campus for the whole school day, and at aftercare, that we have healthy meals and healthy foods in the vending machines, that gradually we move toward less marketing, toward, an occasional party, which is really fun, which is a treat, where kids are rewarded in ways that are healthier. They're not, their recess isn't withheld because they were too noisy. That, overall, I think that, I hope someday, my grandkids will say to me, they used to sell soda in schools. Are you kidding me? That just the way people think about smoking. I mean, even when I was in middle school, kids could smoke outside at school. In high school, I think they had smoking lounges at one time, but certainly there was this wall that was like the school line property, and all these kids used to smoke there. That even I remember recently going to a fundraiser at an Irish pub, and I have to say, as a mom, I don't get out to bars much. And so when I was getting ready to go to this bar for this fundraiser, I was thinking about what to wear, and I thought, I don't want to wear anything that has to be dry cleaned because it's going to smell terrible. And then I got there, and I forgot we had clean indoor air in D.C. Finally, we were kind of slow in getting it, and there was no smoking in the bar, and it was just so nice. I came back and I didn't have to take a shower, afterward. The way, when I was younger, you come out of a bar and you just smell terrible. All your clothes immediately have to go into the wash. So, I think that we're making some progress, but we're still a ways away from that kind of fundamental shift in our thinking about food, where the healthy choice is the easy choice, where the healthy choice is really the desirable choice as well. And so I look forward to your questions and discussions. Oh, I was supposed to be saying all this when, actually, why don't we open it up with this? I wanted to ask you all, so what are some of the things that you're already doing, or things that if you're not engaged in nutrition policy that you might do right now? And then what are some of these things? So this is my list, which I can't see from there. So things that I talked about that you might be willing to do to help. So, help with the National School Nutrition Standards, comment to USDA, call your member of Congress. Do you already belong to an action network from an organization that keeps you in touch with either state policy or national policy? I mentioned a few here. We have an action network at the Center for Science and the Public Interest, but also the American Public Health Association does, the American Dietetic Association, the American Heart Association, the American Diabetes Association. You could join a coalition if you don't already belong to, the state coalition, the National Alliance for Nutrition and Activity. You could work with schools to try to help them serve healthier foods, whether it's directly helping the school, identify resources that are out there, trainings that they could go to, technical assistance, recipes, best practices, helping them to address the financing issues, make sure that they qualify for the 6 cents reimbursement to make sure that those extra resources go to your school or your school district. You could help them implement the wellness policy, volunteer for a wellness policy committee, or for those of you who are capable, in a position where you could actually help provide technical assistance and support for wellness policies in a school district. You could help to get the state or your work site or your city to adopt nutrition standards for the cafeteria, for vending machines. So these are just a few things based on what I talked about today. But why don't we kick off the discussion with just some ideas of things that you're already doing or inspired to do, and then also get to whatever questions you might have.
One of the barriers that I face, I work at a high school, and that is that if the kids will not eat it, it doesn't do me any good to serve it. And so we have to be very careful about what we serve and how to make the healthier choices more enticing. And I think that's the biggest challenge.
Mm-hmm. Yeah. I think if we expect schools to change all this stuff on their own, it's impossible, because the kids have grown up in this junk food environment. There's what they've been eating at home. There's all the marketing they're exposed to. It's what the fast food restaurants market to them. It's what's considered a kid's meal. If you look at the kids' meal menu at every restaurant, it's hamburgers, pizza, some kind of fried chicken nugget, chicken leg. It's macaroni and cheese with a side of fries and a soft drink. Mm-hmm. So then they go to school, and that's what they want, same kind of thing. And so we have to all work together and move this in a direction so that we not only change the food that the kids are served, but find a way to get them to eat it. And I think you're right. We can't do this in a way that just looks good on paper or that meets certain nutrition specifications that USDA so carefully laid out based on the science. And it's hard. There hasn't been the kind of investment in nutrition education in schools that we need. We tried to get an additional $150 million for nutrition education in this reauthorization so that the meal changes would happen along with an increased investment in the team nutrition program, that every state would have a team nutrition program, director, funding that could work with school districts around their state. And of course, Congress didn't fund that part of it. But have you had good luck with taste testing or having the kids give input to the menu? Does that help?
It's something, sometimes as simple as instead of putting our fruit in a stainless steel pan, that we put it in a nice bowl, and it just looks better. It's more enticing. So sometimes it's the little things that make a difference. But but we always have to be mindful that our kids will either skip lunch, which they do, or they will think, well, I'll just grab something at, Taco Hut after school, or I'll bring something from home, and what they bring from home is generally worse than anything I could serve them. Mm-hmm. So, we have to make them want what they should eat.
Yeah.
Somehow or another.
I had a good meeting with the National School Nutrition Association a couple of weeks ago, and I've talked to USDA about this too, about a national marketing effort around the school lunch program, because I think it has a bad reputation, that people picture something very different than what's in the average cafeteria. And I think we need to help parents understand what's there. So, in elementary school, the parents will have their kid participate, and then we need to market it to the kids in middle and high school so that they'll want to participate. I know my daughter's in middle school now, and the meals didn't used to be very good years ago. They were shipped in frozen from Pennsylvania, and they were heated up, so everything had to come in like this little tray. And some of the things were okay, and some not so great. So they switched over to a new food service approach, and the meals are totally different than they were. But not a single parent knows about the change. And the kids, the culture at her school has always been to bring your lunch. The cool kids all bring their lunch in lunch boxes, which I have to say is not what was cool when I was in middle school, but that's, cool today. At least in my daughter's middle school, they all bring lunch. And then so the low-income kids don't want to participate because that's not what kids do at Deal Middle School. But she's never once tried the new lunch. It changed over the beginning of 7th grade. She just said, oh no, the food is bad here. And so, getting the kids engaged and involved and thinking about it differently, I think is really important.
I'm from Warren Township School District. We're located on the east side of Indianapolis. And 6 years ago, our school board and superintendent started reevaluating our program, our school lunch program. And we decided that, I might have to duck as a few bottled waters get thrown at me. We decided that it might be in our best interest to actually hire a food service management company to kind of oversee our food service department.
I'm not going to throw it out. I'm
Yes.
all for food
However, I
service
saw a
management.
lot
Whatever
of people
works for your
stand
school
up
district.
that work for school districts. And the same bad reputation I think that has for school food also has for management companies. I don't work for them. I'm employed by Warren Township, but we have had great success not only implementing all the new requirements, but these requirements are actually implemented before they became law, or now becoming law very, very soon. So I just kind of say out to many school districts, if they're having troubles, like what you said, to implement these issues, to find very cost-effective alternatives. Something they may want to look into is actually look into hiring, or at least talking to a food service management company. We use Chartwell's at our schools, but there are other options out there as well. I'm not promoting Chartwell's. I'm just saying there's a lot of options in what we do. It really works well. So just want to throw that out there.
I think with school districts, it's varied what their experiences have been, but it seems like the major school food service management companies are trying to work toward the new standards. Now, how many folks have healthier U.S. schools in their district? So do you guys? That's
our school district.
You guys are all together.
Yeah.
So do folks know about Healthier U.S. Schools Challenge? So USDA has an incentive program that are like certification program. I don't know how you want to, depends how you think about it. They lay out criteria for elementary schools, criteria for middle schools, criteria for high schools that have to do with the meals, the foods outside of the meals, participation in the meal programs, physical activity. And if schools meet certain criteria, they can become certified as a healthier U.S. school. There are different levels like bronze, silver, gold, gold with distinction, depending on how many and which criteria you meet. And then school gets a small amount of money. Was it like $500, $1,000?
For silver, it's $1,000.
So
I don't know for bronze or gold.
So yeah, the amount of money, it's modest, but if a whole school district does it, like Montgomery County schools, I went to when they were certified and they got their check, and every single elementary school was certified as bronze, and so it was a good amount of money. You know, they were trying to decide, I don't know, between a walk-in refrigerator and, you know, a couple of other things that they could buy with the money. But so it's an incentive support program to help move schools toward healthier school foods.
And we, like I say, challenge them to not only meet these requirements, obviously, but to do these extra benefits for the school, for our students, because, you know, bottom line, we work for the students. We need to not only educate them in the classroom, but it's got to be education in the cafeteria as well. So we challenge them and expect that out of them because they have those resources in their corporate world to bring that down to our school district. So, you know, it obviously will be better for our students.
A lot of times advocates have ideas about what a ideal school lunch program should look like. And so some think, you know, there should be scratch cooking in every single school building across the country. And that's a nice little idea, or maybe a nice big idea, but, you know, it really has nothing to do with nutrition. It's kind of like I don't know, it's like, let's bring back the horse and buggy. You know, like it's kind of a quaint idea that, I mean, scratch cooking can be very good and works well for some schools, but oftentimes the central kitchen is a much more cost-effective, streamlined approach where schools can get better efficiencies, and it requires less training, there's better food safety handling, you know, and there's it works really well for them. Some do well with food service management companies. Others prefer to do it themselves. Some have the high schools cook and then the food goes to the elementary schools. You know, there are lots of ways to get toward healthy food. And, you know, when anybody starts talking about we should require scratch cooking or we should require this or that, you know, I don't think we should tell schools like exactly which vegetables they must serve. You know, you have to have broccoli once a week, cauliflower another, carrots the next, or you have to do scratch cooking, or you can't use any processed foods. I think there are lots of different ways to get there. And we should, you know, lay out the guidelines for what's healthy food for children and then let the experts in food service, you know, work with them to try to get there. So I'm glad that Chartwell's has worked for you. I think they've had good success in some schools and, you know, trouble in others.
I'm wanting to know if there's any kind of a national repository of information. So if I'm a government entity that wants to, say, embark on healthier worksite nutrition options, I'd like to see what other places similar to my size are also doing. Is there any place that I can go through the internet, perhaps, that could give me a whole host of information to look at and kind of drill down to maybe some areas or some localities that have done the kind of work that I'm hoping to try to get done?
You know, it's fragmented. So for work sites, I would send you to the CDC website. The Centers for Disease Control has undertaken some work site initiatives and pulled together some things, though I'm still not sure everything is there. On healthy public places, you know, setting nutrition standards and having healthier foods on public property, we're just starting to pull some of that together. So we have a small section on our website, which I think you'll see grow a lot in the next year. We have a list of a number of states and localities that have adopted policies, a link to their policies, some fact sheets, tip sheets, and other materials. So I think that'll be a good repository, but it's still a little young.
I used to work for another state's CDC NPA program, and that was in the infancy 8 or 9 years ago, and there was a lot of kind of searching around at that time looking for information, and I'd even hoped with that they would have one site that you could go to that showed all the programs that we're doing this specific area or that specific area. And I couldn't find it at that time on the CDC site, but I'll see where they're at now.
Yeah, they just launched some new materials related to worksite. I don't know, folks from the DMPAO, from the Indiana DMPAO funded project, if you guys are doing work sites, but that's one track that they've, been working on. I think, in terms of repository for materials generally, there isn't like a one-stop shopping for everything you ever wanted to know about nutrition policy. I think the Rudd Center has pulled together some stuff. They're housed at Yale University. We have quite a bit on our website at cspinet.org. Actually, here's the nutrition policy section of our site. But it's really, some sections, so I've done a lot of work on school foods and menu labeling. If you want to have menu labeling in your government cafeteria, which is, I think, another good policy, I have a bill, I have a fact sheet, I have a lot of stuff for that. But if you wanted to do something that we're not working in, like childcare, which is a great issue and something really important to work in, I don't have anything. I would send you to the Nemours Foundation or someone else who's working on it. So I think some of it is finding, the right places. And I think if you have a topic in mind, we could send you to a good repository, but they're not all linked together.
I'm wondering if you could talk a little bit about using local produce in schools, either in the school meals or as taste testing, or just getting school garden food and community garden food into the school environments. We're hearing more and more about school gardens, and I'm just really not sure how to encourage more of those, if it's even the right thing to do. So in your travels around, are you seeing that other communities are starting to find ways to get local food into the schools?
So I am a huge supporter of trying to help kids eat more fruits and vegetables. I think it's one of the most important changes that we need to help our kids make and that we need to make as a country. Fruits and vegetables fill you up without many calories, and if we don't eat more of them, I don't think we're going to be able to manage our weight. That I think eating fruits and vegetables, for me, I think it's one of the top priorities for addressing the way we eat and kids eat. I know with schools, they're going to struggle a lot to try to find ways to get kids to eat those fruits and vegetables, and we're going to work with you, but it's going to be hard. But we have to do it. I think it's one of the most important changes. Now, to me, as a nutritionist, I don't really care where the fruits or vegetables come from. And now I'll have to duck from the water bottles. So it's an important environmental issue. I think it's a philosophy that some have about supporting local agriculture. I think there are a number of reasons to support local agriculture. And I love the farmers market and I love local produce. But I think it's important to get good quality produce that tastes good. I think looking at seasonality helps you in terms of pricing and taste. But I think that local produce is always just going to be a small part of the produce that we have in schools because of the way the school year is structured and the amount of produce that's available. That, schools that are doing a great job with farm to school are getting like 10, 20% of their produce locally, and it's only during certain times of the year. That I think it's a way to supplement the produce that we need to have in schools, but in terms of national priorities, we don't work on it because we just feel like so many other problems. I think it's been something that's really motivated and gotten a lot of people excited about nutrition, and I think that's really good, and I understand why other people think it's really important, but it's never going to be the major source of produce for schools.
I'm Rachel. I'm a registered dietitian at IU in Bloomington for dining services, and with the local produce at IU, our executive chef always tries to incorporate local produce when he can, but like for example, this last summer we supplied our major food court salad bar with tomatoes from a campus garden. And it was just for that one dining hall amidst the whole campus that it was enough to supply it for. So just realistically starting like with one thing at a time, and I think that's what a lot of universities do. They start with one item or one thing. Like we do local apples as well from Indiana, and sometimes the quality isn't as good, so we aren't able to supply the university with all local apples. But if we just focus on like one thing at a time and just doing, you know, what we can, it's possible like that, you know, to start small. And I wanted to comment also on the workplace wellness. The Cleveland Clinic has a really great program that it's basically, I think it's called like 360-5 wellness, and Dr. Michael Roizen, he's the chief wellness officer at the Cleveland Clinic. They basically have all these, it's a wide scale effort at the Cleveland Clinic for employee wellness, and they have a tip of the day that you can sign up for in your email, and I pass that along to my employees sometimes. So it's really great. It's a really like already established program that they have a model for. So like they've done a lot with like a totally non-smoking campus and like issues with like activity, and all the tips are they're a wide scale of topics. So I think they're really great for any employees. So if they come every day. So and at IU on campus we have a program called Eat Right, and it's just one concept in the food court, and it's just an example of us starting really small. And we have healthy options for the college students where they can get something that's a whole grain, like less than 30% of the calories from fat is the requirement for the entree, and then we incorporate like seasonal produce and things like that. But there's other universities that are doing bigger things that, you know, it's good to, and other schools that are doing bigger things that we learn from. Like University of Iowa does Wellness Wednesdays, and they do like, they take the salt shakers off the tables in the dining halls every, you know, Wednesday, or they do no fried foods on Wednesdays, and they do baked things. So just, I think starting small is a really big key.
Or to do some modest gradual reductions in salt or increases in whole grains across the board. And those can end up impacting different populations and having different kinds of impact. So say if you just have, you know, the healthy choices available that are marked with a little gold star or marked with a heart check, or, you know, they're somehow indicated, then people who are already interested in nutrition will be able to choose those options. And that's a good thing. You want to make sure that those healthy choices taste good. There's nothing worse for the whole field of nutrition than having bad tasting healthy options and marking them as healthy. So calling it the garden selection is this, and then you have like plain steamed broccoli, and you have overcooked, you know, broiled chicken with no sauce and no flavor. And then everybody is then, that teaches people that yes, healthy food does taste terrible and there's no reason they should ever eat it again. So when you do mark anything as healthy, I think you are under a lot of pressure to deliver good taste, because otherwise you are hurting the whole nutrition education effort that, you know, people have been trying to do. And actually, I'm not a big fan in a restaurant type setting of marking things as healthy. I prefer to just post the calories next to it and then let people see for themselves how things stack up. Because some things that aren't considered healthy, like sirloin steak, is a pretty good choice, whereas, you know, some things that people think are healthy, like a chicken sandwich, could be a lousy choice, you know, if it's smothered in bacon and cheese and, you know, greasy sauteed mushrooms. So, like, I think just put the calories there and let people decide for themselves, as opposed to like saying this is the healthy choice. Now, another thing to do is to do across the board reformulations gradually over time. I think that's more of a public health strategy and is probably going to have a bigger impact because most people aren't going to even notice. You can usually take out about 20% of the salt in a lot of dishes and it won't taste any differently. No one will notice because people have never thought about how much salt they're really putting into those recipes that are, in the hospital cafeteria, in the government cafeteria. And you could take that salt right off the top and it tastes perfectly fine. You could use less cheese on the burgers. You could make the default burger a leaner burger, and put a nice barbecue sauce on it, so that it tastes good. You could switch to a partially whole grain bun just across the board in the whole cafeteria and don't even make a big deal about it, Or if you think people are going to, mind, tell them why you're doing it. But those across the board reformulations are the kinds of things we need to do, not just offer one healthy choice for the people who are interested in health. Because quite frankly, I'm sick of chicken breasts and salad, which is like the thing that they always say is what, if you're interested in health, you should choose with the little check mark next to it. There's only so many chicken breasts and salads a person can eat. When there's a million other things that are, equally as healthy. So, I think when you're thinking about how to make these changes across the county health department, in government cafeterias, in vending machines, to kind of think about these different approaches. There's like stealth changes across the board. There's gradual reductions. There's, ways to phase things in. And in schools as well. And then how much education and buy-in do you need? Some changes are going to be easy. People aren't even going to notice. If you switch the kind of frying oil that's used, or you switch, to a leaner ground beef patty, if you get, something that's good quality, or you figure out how to make it in a way that's still moist, people won't notice, and then you don't have to make a big deal about it. But if you're going to get rid of all the soda, you probably want to tell people and tell them why and, do some taste testing and figure things out. That people have a lot of opinions about food, as we all know, adults and kids. And so we need to help people understand why, give them, a chance to taste different options and see that it tastes good. This idea that healthy food doesn't taste good, it's crazy. Healthy food tastes great if it's good food, if it's made well. I think probably the dinners I make at home are 1,000,000 times better than what McDonald's sells. But, it's what you're used to, it's how it's prepared, it's the spices, it's the, whole method of preparation. And so I think we have to help people see how great it is. It doesn't have to be a sacrifice. The problem is that in today's world, in today's food environment, it is a sacrifice. And that's what's wrong with our food environment.
Speaker, what we're in fact observing through the Indiana School Health Network is that a lot of school corporations in the state of Indiana are in fact self-insured. And as a result, they are still suffering spiraling healthcare costs for their employees, and they're trying to find new ways to manage it. And so what a number of them are doing in partnership with 3 of the largest state hospital systems are developing employee wellness programs and in some cases full-blown employee health clinics. They are driven by a different motive, i.e. managing their budget, but they are in fact moving back into a model that a lot of people in this room are familiar with, the Coordinated School Health Program, which in fact includes staff wellness as one of its main 8 components. Some of the folks that we've in fact talked to from these hospital systems and school corporations, unfortunately, never had an opportunity previously to get involved in the Coordinated School Health Program or to make the connections that we're trying to do here today. But as an opportunity to kick the conversation literally up to a board policy level, once a school corporation does that, then people should be looking at that as an opportunity to connect the dots for the other topics that we've been talking about here today, because the experience we've had thus far is even relatively large hospital systems aren't connecting the dots in terms of saying, well, if you're going to do that, then this ought to be the next step that you follow up on.
That's great. I think, too, and as they start to see it and start to want to make change, to help them see that it's more than just making sure that people have a cooking class or an opportunity to be screened, but to help them also include components that are more comprehensive, things like changing what's in the vending machine, changing the cafeteria, offering physical activity breaks, offering, subsidies for gym membership or on-site physical fitness facilities, or a place to park your bike that's safe, that people don't have to worry about it. I think building in those kinds of things into their idea of worksite wellness is really important, because sometimes they see worksite wellness as like, well, we're going to send an email to all of our employees, once a week with a health tip. And I think a health tip is nice, but that's, these other kinds of systemic changes make a bigger difference. I like the idea of worksite wellness for school employees too. I think that makes a lot of sense for the health of the employees, but then also for helping them to better understand the importance of nutrition and physical activity. Once people incorporate it more into their own lives, they start to think about why it might be important to their kids and are more open to other changes as well.
Hi, Margo. I just wanted to mention that I'm in the back of the room, and my name's Beth. I work for the Department of Education, and for any of you who are working in schools and you're interested in knowing more about the Healthier U.S. School Challenge, see me. I'm working with the state agency with all the schools that are applying through some Team Nutrition grants. And I think in Indiana we do a really good job. We have Marion County Health Department and our state health department working with the Department of Ed, and we've really come a long way, I think, in the last few years.
So how many Healthier U.S. schools do you have in Indiana? Do you know?
Well, we have one school corporation that's already been awarded. It's in Crown Point, but we have 60 schools right now that are working towards getting their applications turned in.
That's great. Well, I think this is my signal that our time is up. Thank you again for inviting me, and I look forward to hearing more about how things go. It sounds like there are a lot of changes being made in Indiana, and still more work to do. So thank you.